So here we are today with Guy Vinograd from BioT, which is changing the way we do medicine. Could you tell us the big difference that BioT is making in the medical services, medical devices market?
Sure. So we are into the remote care business. And it started with telemedicine and just video calls between patients and doctors. But actually, doctors use a lot of devices when they analyze the problem of a patient and when they treat the patient. So the next generation is to send those devices to the home of the patient and let the patient use those devices to get better and to get monitored remotely.
Could you give us an example of one of your customers, a company that's benefited from your technology?
Sure. Victorious is a heart implant for congestive heart failure patients. Now, in the Corona days, they don't want to go to meet the doctors at all. So, what Victorious is doing is a heart implant that can measure the condition of the heart and allows, via BioT, to monitor them remotely. And this is huge because those patients have constant exacerbations, go in and out of the hospitals. And with this combined solution of BioT and Victorious, they don't need to go to the hospital, they don't need to go to the doctor.
Okay, so you have all these devices around the world, gathering information every day on probably millions or tens of millions of patients. But there's a problem with the infrastructure that handles and manages and stores this information, right?
When you go to the reality, you see that those companies are struggling. The companies of the medical devices now require to create not only this hardware device, but an entire remote care solution. So all those challenges are slowing them down. They can't put this kind of resources. They must do it not in 5, 6, 7 years. We need to do it now because of Corona and other issues.
Your primary customer are medical device companies that want to go right to market with their product that already has built-in connectivity to a cloud so that they can offer solutions that are secure, that protect their clients' information, and that can manage the data in a smart way, right?
So these guys want to connect to the cloud. Now they are adding their own connectivity module so they can transmit anything to anywhere. Sometimes it's to an application, then goes to the cloud. But then they get afraid and see all the risks with transmitting patient data to the cloud. And that's where we step in. We built in BioT our product called the BioT Engine. We know the problems of all those tens of thousands of companies, and we have implemented those medical IoT built-in modules that takes care of the data channel, including cybersecurity and privacy, and then also manage the flows, the workflows of remote care, allowing the patients to manage and control which kind of other users in the system, physicians, etc., are allowed to see their data, for example, allowing physicians to monitor like 1,000 patients out there and extract the right one to the hospital visit when it's needed.
How do you want to see the world in another 10 years because of the work of BioT?
So in 10 years, I would like to see like 80% of the capabilities a hospital can do. I would like to see it in the homes of people. And the way to do that is to enable the remote connectivity for all those tens of thousands of companies. We want to be the heart of this industry, much like Intel for computers, so we want to be the Intel inside of the remote medical care industry.
What do you need to go to the next level? I love the vision. I love the vision. 80% of medical care being remote, people not having to go to hospitals. You know, you go in with one disease, you come out with another disease. What does BioT need to take your company to the next level?
Our product now provides a lot of great functionality. I mentioned it earlier, but now it needs to scale. It needs to support thousands of companies now and tens of thousands later very quickly. So we're now looking for a seed funding investment, a $3.5 million investment, first to make the product self-service with a lot of features that we can give to any kind of an integrator or software house or the medical device manufacturer itself, and they can build their own solution on top of it very quickly. And secondly, of course, we want to start getting the US market first to leverage BioT.
And if you think about a strategic partner, somebody that would bring in funding but would also be able to open up markets or help you in another strategic way, what would be your optimal investor?
Connections in the healthcare industry in the US, mainly to life science companies and the medical device companies.
What an inspiring story. So please be in touch with BioT. Please go to their website, learn more about them, especially if you're in the area of medical devices, medical care, even pharmaceuticals with drug delivery devices. They need strategic partners today. They need investment, but also strategic partners that'll help them break into new markets, particularly the United States, but around the world and other places as well. Be in touch with them and keep tracking with the rise. Thank you.